A very good evening and a warm welcome to all our esteemed guests and to dear learners. I am Dr. Ria Tukral from the Homeopathic Academy, and we are here today to discuss a very interesting topic with Dr. Saptarshi Banerjee. We have Dr. Banerjee live with us right now, but before we go ahead with this webinar, most of you already know about the Homeopathic Academy, but for those who don't, let me quickly introduce ourselves. So, the Homeopathic Academy, or THA as we call it, is DGN's effort towards digitalizing homeopathy and providing a platform for quality education online. It offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at undergraduate, postgraduate, UPSC, and CME levels. All these courses are enriched with state-of-the-art audio-video technology, text and vector animations, giving you an HD quality audio and video experience made by a team of qualified doctors, video editors, and many more professionals. These courses will completely and perfectly complement your studies to make learning an extraordinary experience. On your screens, you can see some of our courses currently streaming on our website, www.thehomeopathicacademy.com. You can also see the course on Learning the Art of Rapid Classical Miasmatic Prescribing by Dr. Saptarshi Banerjee. Here, Dr. Banerjee will teach us how to include miasms in our homeopathic prescriptions. He ensures that with proper application, miasmatic prescribing can uproot the underlying cause of disease and nip the bud of increased susceptibility to future diseases as well. So don't miss out on gaining the wisdom. Enroll in Dr. Banerjee's course at our website. Also, you can also see some of our upcoming courses, and just an announcement for you all, we have a new course launched in this very month that's on 4 ways to rejuvenate your practice with Dr. Frederick Schroyens. You can visit our website to enroll in the course and avail 30% off on it. And our upcoming courses include a very sought after and looking forward course that's Comparative Homeopathic Psychology by Dr. Philip Bailey, and a UPSC course for for cracking your UPSC and other exams, General Anatomy and Physiology with Clinical Approach, which is based on MCQs. So that's about us. Coming back to this webinar. So Dr. Banerjee, can we please have you here with us?
Yeah.
So we have him right here with us. Thank you, sir, for being here.
Thank you.
Let me introduce you to all our learners today. So Dr. Saptarshi Banerjee, his clinical acumen and wisdom comes from his illustrious father, Dr. Subrato K. Banerjee. He has inherited 5 generations of wisdom in homeopathy and heritage of over 100 years. He finished MD with specialization in Materia Medica. He was awarded a gold medal for his first position in All India MD entrance examination. He holds postgraduate workshops in various places like Malaysia, Bangkok, and Tokyo. He is a lecturer at Allen College of Homeopathy, England, and he offers international programs for overseas homeopaths frequently through Bengal Allen Medical Institute. Also, he is the author of various books, articles, and research papers. Some of them you can see on screen. So thank you, sir, for being here with us. And before I hand over to him, let me quickly explain our learners how this interface works. On the right-hand side panel of your screens, you have a short chat box. You may type your question or whatever message you have for Dr. Banerjee right there and press the button next to it to send it to us. I request you all to send your questions only after Dr. Banerjee's lecture is over, as that might disturb him and we wouldn't want that. So without wasting any more time, let's start learning. Over to you, sir.
Thank you very much. Good evening, everyone. Those who are joining in from the subcontinent. Hello to anyone if you're joining in from overseas. We have a very interesting topic today. We'll be talking about a case of cystic hygroma. This is a very interesting diagnosis, and I'll be sharing with you, obviously, the miasmatic differentiations. And it's always best to learn from a case, and especially a cured case, how you dissect the case miasmatically. At the same time, I'll be also sharing with you a few very interesting clinical tips and comparative Medica. As you understand, cystic hygroma is more a glandular condition. So I'll be sharing with you differential diagnosis of scrofulous remedies from the Medica understanding. So comparative Medica, I'll be sharing with you at the end. So without further ado, I'd like to start off. This is a case of a baby. He was 3 months old when the diagnosis was made and the baby came to us with the parents. There's a soft swelling on the right side of the neck, so it was more like a soft swelling. So, I'll be sharing with you my thought process, how we go about case taking and prescribing as well with this case. So whenever you're coming across a soft swelling, forget about the diagnosis. You have to think from the point of view of Medica that now, which are my medicines which have soft swelling? Which are my medicines which have stony hardness? So whenever you come across this kind of soft cystic swelling, or whenever you come across lipomas or fibromas, you understand those are more soft tumors. And you have other remedies I'll be sharing with you later on, which are remedies for more hard, stony hard swellings, or even just hard swellings. So this baby came to us with a soft swelling, on the right side of the neck. And it had been since birth, so it was almost like congenital. And it was gradually increasing in size. The affected area was slightly red, but it was painless. So you understand there was some degree of inflammation, but there's not much pain, as you understand the baby didn't cry on pressing it. So there was slight degree of redness with the inflammatory changes, but not to that extent to elicit pain. You understand with a baby, there are not much present complaints or symptoms, but we depend on objective symptoms. Catches cold easily, that was quite important from birth itself. So there's quite a lot of sneezing and runny nose, and you understand no more symptoms could be got, but what the parents said is baby used to sneeze quite a lot, runny nose was there. Stool was around 3 to 4 times a day, semi-solid, little mucus, sour smell with the stool. You understand with the baby, again, it's difficult to gauge a thermal relation, but the mom was quite confident that her child didn't want to put on much covering, so we interpreted that as hot. Profuse head sweats, so that was also an important finding. Restless sleep, you understand the baby wasn't having a good night's sleep, so it was restless. Could be because of some degree of irritation with the glandular swelling. Also partially could be due to the frequent cold which he was suffering from. So that those two factors could have contributed to the restless sleep. Mentals, again, depended on objective symptoms. Baby was quite alert, baby was active, startling from sleep. So that was one interesting finding. Probably could be, sometimes even very small children can also come across panic attacks, or like a night terror, and there was some degree of startling as well with the baby. My friends, whenever you are doing a pediatric case taking, if you are a graduate joining in today, do always remember it's a cardinal mistake if you don't ask about the pregnancy history. Up to age 12, so up to adolescence, please make sure you ask about the pregnancy history. So whenever I say pregnancy history, make sure you ask about PEDD. What is PEDD? Any physical factors. So any major injury to the parent during pregnancy, got wet in the rain. Any emotional factor, so any grief, any disappointment during pregnancy, any fright during pregnancy. D for disease, so mom had typhoid, mom had chickenpox, mom had rubella during pregnancy. So sometimes all these factors have an effect. And what is the last D is drugs. So any iatrogenic factors. Mother took insulin during pregnancy, mother took a lot of corticosteroids during pregnancy. So all these factors do always come in handy. Any case taking, you need to ask about the etiology, but especially for a pediatric case taking, whenever you're coming across the pregnancy history, do please make sure you ask about any physical etiology, any emotional cause, any disease, any drugs, which can have an effect. So up to age 12, for my young graduates, do please remember, make sure you ask about the pregnancy history. Next, please make sure you ask about the delivery history. So during delivery, was there any birth trauma? Was there any injury? Was it a prolonged labor? Was it a C-section? Any complications post that? And post-delivery as well. Was there any complication? Was there hypoxia? Was there cyanosis or jaundice? So pre-delivery, there's a pregnancy. During delivery, any trauma or mode of delivery, and post-delivery. Up to age 12, please make sure you ask this question. A. B, please make sure up to age 12, you ask about milestones. For a 50-year-old, you don't need to ask the milestones because the patient has had a lot of exciting factors in his life post after the milestone. So, asking a 50, 55-year-old about the mother's pregnancy and the delivery history is, putting the joke on you. So make sure you ask about pregnancy, delivery history, as well as milestones to the children, especially below 12 years. And you always have specific remedies for specific milestones. So if it's delayed talking, if it's delayed speech, if it's delayed walking, you have different group of remedies in the Medica which can always help you. I've shared this with you in earlier sessions as well. To always have a read through Boldland Children Types. That's a very good book, especially if you're handling pediatric cases or you want to do specialization in pediatrics. Boldland's Children Types. It's a very, very good, it's a 20-25 page book, but it'll give you very good understanding of children remedies. Next, for children, again, please make sure you ask about vaccination. And when I say vaccination, it's again putting a joke on you if you write all the vaccinations what the patient has received, what the child has received, doesn't matter. If there was any immediate reaction, if there was any visible reaction to the vaccination, they gave a vaccine, few days later, few weeks later, eye contact stopped. So there you can understand the anamnesis there. So you understand the link between the cause and the effect. And you understand if there is no visible, no palpable reaction, just writing down all the vaccinations what the patient has received doesn't make sense. You understand, if you have read Kent's lectures, you'll see it's mentioned you may have pages and pages of case taking, but actually not a case. So make sure you ask the relevant questions. So that's quite an important factor I wanted to add, especially to my young homeopaths who are joining in today. Pregnancy, milestones, vaccination, that's a very good read. The choice of remedy in this case, my friends, was calc iode. I will share with you the picture to understand why calc iode was prescribed. If you see this swelling, it's very soft, fluidy swelling. So it's a soft cystic swelling. And whenever you come across a soft cystic swelling, calc iode is one of your very important remedies for these kind of soft cystic fluid-filled tumors. And any iodine group of medicines will come in handy. I'll come to the comparative Medica, which I'll spend quite a lot of time. But calcadia iode is one of your leading remedies. You won't find much details about calc iode in Boriquet or in Clark's dictionary, but we have used quite extensively, and those who have attended my sessions, I'm sure you have heard me mention calc iode earlier on as well. It's a remedy which my family has used for generations with very, very good results. I'll come to why calc iode. Soft cystic swelling. the right side of the neck. Here, the side isn't important. Calc iod is a scrofulous medicine. Now, if you understand this, on one hand, you have calcaria, which is in itself a glandular medicine. On the other hand, you have iodum. You understand iodum is for glands. So whenever you combine the effect of these two remedies and put it together, it makes calcaria iod a scrofulous medicine. And you know, my friends, many seminars, many workshops which I have done, people have asked, you know, how can you combine features of two remedies? Master Kent was a master prescriber, and he was very efficient at combining the effect of two remedies. So whenever you're thinking of a remedy like calc iod, it's a combination of two great scrofulous remedies. If you read Kent's Medica for natrum sulph, if you read Kent's Medica for ferrum phos, you'll see it's mentioned how symptoms of ferrum, symptoms of phosphorus put together, and you have symptoms of ferrum phos. Similarly, natrum and sulfur put together, you have symptoms of nat sulph. Calcaria symptoms, sulfur symptoms, in one constitution, you have calc sulph. So whenever you're prescribing such a big polycryst and you have features of two different remedies, and you can combine and you can make a prescription based on that. Again, it's not my approach. As I shared with you, this has been mentioned by Master Kent, and I urge you to have a read and then decide ferrum phos, natrum sulph, calc sulph. You'll find good reference about how to make a synthetic prescription combining the effect of two remedies. Coming back to calc iod, soft cystic swelling, as I shared with you. You remember, my friends, calcaria fluor is more stony hard swellings, whereas calcaria iod is more cystic swellings. Now, as I'm sharing with you the totality, I'll be sharing with you the miasmatic differentiations. So whenever you come across scrofulous glands, do always remember glands fall under the tubercular miasm. Glandular swellings, glandular enlargements fall on tubercular miasm. But whenever there is enlargement of swelling of the glands, psychosis joins in. So if you have very enlarged glands, I'll say it's a tuberculopsychotic miasm. But whenever you come across people who, whenever they go to the fresh open air, they get a cold, and you know, tonsils are affected. You go to the fresh open air, you get a cold, parotids are affected. So you have a tendency for glandular affections, and that's the scrofulous diathesis. And whenever you come across scrofulous diathesis, there is always a feature again of the tubercular miasm. Easily catches cold, resulting in sneezing and runny nose. My friends, again, try and understand this. I've shared with you in earlier sessions as well. SORA, hypoimmunity. Syphilis, destruction of immunity. So, you know, you are prone to get a cold. You're prone to get sneezing, SORA. Now, when that becomes recurrent, when that becomes persistent, every time you come near the pollen, you come near the dust, you go into the air, you get sneezing and runny nose, that's when syphilitic miasm has joined in, and there is destruction of immunity. So recurrent cold resulting in sneezing, recurrent cold resulting in runny nose, that's a feature of the tubercular miasm. And you understand affinity for recurrent cold, you have that in calc, you have that in iodum as well. So whenever you're coming across treating a case where there is recurrent cold and you have tried constitutional remedies, those who have attended the sessions, attended the course, you'll see we have done at the end a section on leading anti-miasmatic remedies. And I've shared with you leading tubercular remedies. And there you'll find that if you prescribe anti-tubercular remedy, that will break the cycle, that will prevent the recurrence. And that is how, you prevent the recurrence in a case of allergic rhinitis, in a case of recurrent hay fever-like symptoms. So you see how we are combining features of two remedies. So you see, when I'm sharing with you calc iod here, I'm sharing with you two aspects. I'm sharing with you how you make a synthetic prescription based on the features of two different remedies coming together, A. B, how you, as you go ahead, you do the miasmatic dissection as well in the case. So affinity for recurrent cold you have in calc and iodum. Hot. The mom mentioned the baby is hot, that he doesn't like coverings. And you understand iodum is the hottest patient in the Medica. So whenever you think of a remedy like calcaria carb, is more chilly. Calcaria silicata, more chilly. Calc ars, chilly. But whenever you think of a remedy like calc iod, the iodum component is so prominent, which makes calc iod is a hot calcaria. So my friends, whenever you're coming across a lot of calcaria symptoms, but A, you have a predominance for glands, B is very, very hot. Do always keep in your mind for calc iod. I'm sure those who are joining in, every one of you use calcarb day in, day out, but may not have the opportunity or the privilege to prescribe calc iod. But I'm sure you'll come across calcaria cases with a lot of glandular involvement. Think of a calcaria with thyroid enlargement. Think of a calcaria with polycystic ovary. Think of a calcaria with tonsillitis. Think of a calcaria with prostatic enlargement. So glandular symptoms in a calcaria constitution. And that calcaria is very, very hot. Do always think of calc iod, my friends. And believe me, you won't be disappointed. You understand what I'm sharing with you is not my experience of 10 years or so, but what I've inherited as an ancestral tip over the last 100 years. And believe me, it works. Profuse head sweats, I'm sure you know that. You have that in calcaria, you have that in silica, sanicula, a few other remedies are there, but obviously calcaria leads that list. Sour smelling stool, feature of calcaria again, hipersulf, mag carb, calc, lycopodium are your top sour smelling remedies. So frequent sour smell with the stool. Sour smell from the whole body. Do remember, my friends, when your well-selected medicine fails, do always try Rheum. Rheum is your medicine for sour smell from the whole body when your well-selected medicine fails. Calc, lycopodium, hyper, mag carb, these are your top polycrests, but if those fail, you can always think of Rheum. Startles from sleep. So night terrors, we are not sure. That's why we have put a question mark there. Again, feature of calc. If you think of the miasmatic dissection, night terrors is more related with fears and nightmares, more a feature of soda. You understand calcaria. This has been mentioned by Farrington in his clinical Medica. Whenever somebody comes and tells you I have all the fears under the sun, that's always a feature of calcaria. So the night terrors can be a feature of calc as well. So what you got up to here right now, miasmatically, glandular swelling, enlargement, so more tubercular psychotic, glands tubercular, enlargement psychotic. Easily catches cold resulting in sneezing, so recurrent cold, it's more tubercular. So you got more tubercular symptoms up to here. Obviously, you understand we are having scarcity of symptoms. Night terrors, it's more soda. So amongst the little bit of symptoms we have encountered, I will say it's more tubercular symptoms. Again, you understand, my friends, keep it simple. Homeopathy is simple. So if you keep it simple, prescribe on what you see. What you see, what's the present complaint? You see the large enlargement of this, huge enlargement of the gland. So that's psychotic. Where it's affected, it's affecting the glandular areas. So it's more like a tubercular psychotic miasm. And my friends, calcaria iod is one of your leading tubercular psychotic remedies. So you understand, we are putting miasmatic weightage on one hand, glandular enlargement, affinity for recurrent cold, tubercular. On the other hand, we are putting symptoms of calc iod, hot, profuse head sweats, sour smell with the stool, night terrors. These are features of calc and iod. And when you combine miasmatic totality and symptomatic totality, you're getting two sides of both the coin, and you can see the coin. And you understand how calc iod works. So you come across cases, if you want to keep it absolutely simple, you come across cases of calcaria with a lot of glandular enlargements, tubercular psychotic, or you come across a calcaria who is very, very hot, again calc iod, or you come across a very emaciated calcaria. You understand calc carb is more on the 3F side, fair, fatty, flabby. But whenever you think of iodum, that's more emaciated. So if you think of a calc who looks very emaciated with a lot of glands and who's very, very hot, again, calc iod can come in as well for those conditions. In 2017, we started with calcaria iod 200C. You see, we gradually gave placebo. There was one acute attack of loose stool with a lot of mucus. Aloes 6C was given for the acute attack, but we didn't need to repeat the 200C after that. The size was gradually getting better. You see, just one single dose was given in 2017 September. And we followed up after we generally do a repeat ultrasound in a year time, and there was no evidence of hygroma. And we always ask the patient to continue treatment for another 6 months so that we assess there is no chance for recurrence, and we sign the patient off after that. You see the ultrasound of the neck. This is, you see the date 2017, which mentions about a cystic swelling in the lower part of the neck, right side, as described. Findings are consistent with cystic hygroma. Cystic hygroma, my friends, is more like a fluidy collection. If you look up modern medicine, if you look up conventional medicine, you'll see it's mentioned the only treatment is surgery, nothing else. But we have had loads of cases where there's a lot of recurrence even after surgery. This was, we did in October 2018, exactly a year post-treatment. You can see heterogeneity in the lower part of the neck with few shadowy foci, no obvious cystic component in the lower part of the neck, no vascularity. So it was not there at all. If you see the pictures, this was when we started off. You understand, it's soft cystic swelling. You see some degree of redness, as I mentioned, so inflammatory changes. And you see how gradually, this was May 2018, we started around September 2017. So you see gradually it started to shrink. July 2018, this was far better. And this was at the end of the treatment when we signed the patient off March 2019, where there was no evidence of the hygroma. And it was just a single dose of calciode which completely cured it up. It was, again, my friends, it is not a clinical tip for all cystic hygromas you'll give calciode. No, never. But you have to understand here, we put the miasmatic weightage of tuberculocycotic miasm, tubercular in terms of recurrent cold, the glandular component, cycotic in terms of the huge enlargement, which you saw in the first picture. And the redness as well, my friends, the slight degree of redness is tubercular. You always remember, in tubercular, there can be inward congestion or outward congestion. What do you mean by outward congestion? There is hemorrhage. So epistaxis, profuse menstrual bleeding, any hemorrhagic symptoms are tubercular, like you have in lacasis, you have in phosphorus. So that is an outward manifestation of congestion. But you can also have an inward congestion in the tubercular miasm. If you recall our first session in dermatology, I shared with you where you can have redness in the skin, flushed skin, which you see in rosacea. That's tubercular as well. That's an inward congestion. So the redness is also a feature of tubercular miasm, and there was a certain degree of redness as you could see in this picture. So that redness is also a feature of the tubercular miasm, and that comes into the purview as well. So you're putting miasmatic totality on one hand, where you have tubercular symptoms with psychosis, and then you're putting symptomatic totality on the other hand, head sweats, sour smelling stool, hot, recurrent cold, night terrors, you're done. And there you have calciode. So try and put those into your practice, or at least implement calciode in your practice with the miasmatic importance. My friends, the course we have done, it's a very important factor to understand that miasm is always an important factor in your totality. And miasm is always like the elephant in the room, which no one wants to talk about. We all do hue and cry about, yes, we have to make miasmatic prescription, but actually how many of us do make it when we are treating patients in our daily practice? But whenever you're implementing miasm in your practice, I've shared this with you very many times in the past as well, do not change the way you prescribe. I do not prescribe based on repertory, but doesn't matter. You may prescribe on repertory. So whatever way you are prescribing, whatever methodology you are prescribing, you have to implement miasms in your practice. And because the symptomatic totality, you can make it based on any approach. You're using repertories, you're using mental rubrics, you're using just keynotes. So it doesn't matter whatever weapon you're using to prepare your symptomatic totality, but you have to complete that symptomatic totality with miasmatic totality to make it two sides of the same coin. And that's why it's my earnest request to implement miasms in your practice. So that's about your cystic hygroma. I'll do a quick differentiation and comparative Medica of these remedies, of the remedies which I was thinking about. I'll share with you my thought process. Sometimes, when we are dealing with patients in our Calcutta clinic, also in our slum clinic, especially in our slum clinic, I deal with about 50 patients in about 3 to 3.5 hours time. So you understand, there we have to depend on ancestral tips as well as look and diagnose. So I don't have time to open my computer and put in all the rubrics and ask for dreams and delusions in my slum clinic, or ask, what do you like to eat for dinner? Because they will say it's only dal and roti, and that's half of India, lives like that. So you have to understand what's the reality and truth, and sometimes implement that in your practice, my friends. Coming back, so I'll sharing with you my thought process. Looking at the swelling, pressing at the swelling, it's a soft cystic swelling. So the first remedy which came into my mind is obviously calcaire, soft cystic swelling. But my friends, do also remember Lapis alba. I've shared this with you in earlier sessions as well. Lapis alba is a very interesting medicine where, if you look in Boricae later on, glands have a certain elasticity and pliability rather than the stony hardness of cystus and calc fluid. This is the exact line in Boricae's Medica. I repeat again, glands have a certain elasticity and pliability. So it's more elastic, it's more pliable rather than the stony hardness what you find with calc fluid or with cystus. So whenever you come across this kind of cystic swellings, or like a lipoma, fatty tissues, fibromas, dermoid cysts, which are not being able to help, do think of calcaire if you have a good calcareous totality. B, do think of Lapis alba, where I repeat again, there's a elasticity and pliability rather than the stony hardness of calc fluid. So there you have this kind of cystic swelling as well. My friends, any iodine group of medicines will always help you in these kind of cystic swelling. So if you have a good sulfur totality with these cystic swelling, do think of sulfur iode. Very many times, believe me, my friends, I haven't prescribed, I have a good totality of sulfur, but patient came to me with a lot of lipomas and fibromas. Patient had a good totality of sulfur, but patient came to me with a lot of cysts and thyroid disorders. I went for sulfur iode. The sulfur iode, again, whenever you have a lot of good sulfur symptoms with iodine, you think of sulfur iode. Similarly, baryta iode. Whenever you come across baryta symptoms, like a hot baryta with a lot of glands affected, you understand baryta is also a wonderful remedy for glands. For men, you understand prostate and testes. For children, quinsy or tonsillitis. For women, it can be breasts. So baryta symptoms in a hot patient with a lot of glandular enlargement, do also think of baryta iode. Sulfur baryta iode, I want you to go back and try that with your patients, my friends. Sometimes these kind of cystic swellings you can find with lymphomas as well. So whenever you think of Hodgkin's lymphoma or scrofulous lymphomas, fortunately the patient had a diagnosis with the cystic hygroma, but sometimes you can get these kind of swellings with lymphomas as well. My two top specific remedies for lymphomas, obviously iodine group can help you, as I shared with you, calcaire, sulfur iode, baryta iode, but do also remember Scrofularia nodosa, which is a very specific remedy for glands. If you look in Boricae and Scrofularia nodosa, you'll see it's mentioned about Hodgkin's disease. You'll also find in Scrofularia, it's mentioned about the breast tumors as well in Scrofularia. I'll just quickly read to you about Scrofularia. Enlarged glands are present, Hodgkin's disease, specific affinity for the breast, very useful in dissipation of breast tumors. So scrofulous swellings, breast enlargements, especially, my friends, with a lot of drowsiness. If you look in the sleep section, there's a lot of drowsiness. So glandular enlargement with a lot of drowsiness, especially affinity for lymphomas and breast, Scrofularia nodosa. And if you see the common name of Scrofularia, knotted figwort. So there's a knotted appearance of the glands as well, which can be a doctrine of signature. So glandular swellings A, B, breast tumors with a lot of sleepiness and drowsiness. and that's Scrofularia nodosa. Lapis alba, if you have there in Boricae, you'll see in Lapis it's mentioned there's a lot of excessive appetite. It's almost like an iodine appetite if you'll find with Lapis alba. I'll just quickly read that in the introduction. Fat anemic babies with iodine appetite, ravenous appetite. So in Lapis alba, you have soft cystic tumors, glandular swellings, fibromas, lipomas with iodine appetite, and that's Lapis alba. All these medicines work well in 200C, 1M, and 10M. Always for glandular swellings, make sure you prescribe higher potencies. We have a few other cases of cystic hygroma. There are a few in our website as well. You will find where calciode was prescribed, other remedies were prescribed, but we got better results with higher potency. So make sure you don't give up on the remedies before prescribing a 1M or a 10M. So these are more like soft cystic swellings. Another remedy which is important for lipoma, for Hodgkin's lymphomas, is aconitum lycotonum. Aconitum lycotonum is a very specific medicine for Hodgkin's, my friends. But do remember, in aconitum, you will have a lot of fears and anxieties of aconite with glandular enlargements. You understand aconite is more a fever remedy or more glands, more fever remedy or more acute remedy. But aconitum lycotonum is, you'll find this in the relationship of aconite, is a remedy for Hodgkin's or enlarged glands. Along with that, you'll have a lot of fearfulness, a lot of fright and anxieties. They're always worried, I'm going to die, I'm going to die, I'm going to die. So whenever you come across glandular symptoms with that kind of fearfulness and anxieties, do think of aconitum lycotonum. Many people have also had good results with arsiod as well. But my difference between aconitum lycotonum and arsenicum iodatum is in arsiod, you'll have a lot of weakness, you'll have a lot of emaciation, which is very specific for arsiod, but you won't have that degree of weakness in case of aconitum lycotonum. What's similar? Arsiod and aconitum lycotonum both can have fears and anxieties, but in case of arsiod, it's more the debilitated factors of arsenic which creeps in. Whereas in aconitum lycotonum, it's more the fear and anxiety and the fear of death which creeps in for aconitum lycotonum. It's in Boricae in relationship of aconitum nepellus. So these are my few medicines for soft cystic swelling. Obviously, whenever you look at these remedies, look at this kind of glandular enlargement, if you're not sure about the consistency, you feel it's quite hard, few other remedies will come in. Calcaria flu, you understand, I shared with you, glandular symptoms or hard glandular symptoms in a calcaria constitution, that's more calc flu. My friends, I also want you to try Cistus canadensis. It's another fantastic remedy which my family, we have used over generations with very good results. Whenever you come across a patient who's telling you that I have glandular enlargement, along with that, they're telling you they're extremely, extremely, extremely chilly. You understand, chilliness in the grade of sorinum or in the grade of silica or sepia. So that kind of chilliness is there. And the glandular symptoms are worse in cold air, worse in cold weather. You have a very good totality of Cistus canadensis. I want you to, if you have Boricae with you, or later on, I want you to have a look in Cistus canadensis. I'll just read that to you. Deep acting antisodic remedy with marked action glandular swellings, extremely sensitive to cold. And this has been mentioned by many master homeopaths that it has the chilliness in comparison to the degree of sorinum, to the degree of silica and sepia. If you see in the modalities section, what slightest exposure to cold air, they'll tell you, I'm always covering my head, I'm always covering my glands. So you'll feel it's like a hypersalve, you'll feel it's like a silica. But again, what is the sphere of action here? It's glands, glands, and glands. Are they suppurating? No. If it would have been suppurating glands, I would have thought of silica. I would have thought of hypersalve. If it would be sensitive glands, I would have thought of hypersalve. But it's a non-suppurating glandular enlargement. You see, my friends, this is what comparative Medica is all about. A large glandular swelling, you're finding them covering the neck, covering the head, because the slightest exposure to cold air aggravates it. I want to keep it closed. That's Cystic canadensis. Is it suppurating? Is there pus with it? Think of silica. Think of Hypersal. Is it very sensitive? That's more hyper. So suppurating glands, my friends, again, the comparative Medica, Hypersal, silica, mercury, those are your remedies for suppurating glands. But a gland with chilliness and aggravation from cold air, do remember Cystic canadensis. 200C1M are good choice of potencies. So thyroid gland, which is extremely sensitive to cold air, they will tell you it flares up whenever I'm in an air-conditioned room, whenever I'm in a cold room, cystis. In a very chilly patient. In this case, my friends, another remedy which comes close to cystis is belladonna, obviously. Because you understand, in belladonna, I've been taught by my granddad, in belladonna, you have etiology from cold and aggravation from cold. So the gland had started after a cold exposure. You had a cervical lymph node enlarged that started after you're traveling in the train, you got exposed to cold air, etiology from cold. But every time I go into the cold air, every time I'm in the air-conditioned room, this cervical lymph node again flares up, aggravation from cold, belladonna. Believe me, no matter how many rubrics you put up, you won't find a belladonna picture like this. Do remember this, put it in your notes, etiology from cold, aggravation from cold. You'll never miss a belladonna prescription. Why belladonna here again? The redness. Rubocalcidola tumor, there was not that degree of pain to start off with belladonna. That's why I thought of calciode. I thought that if the pain or the redness increases in the course of treatment, I may resort to belladonna. You understand, belladonna calcarea is complementary. But I stuck with calciode in that case. So 2 points for belladonna for glands, etiology from cold, aggravation from cold, A. B, redness. You have rubocalcidola tumor, what you find with the signs of inflammation with belladonna. Doing a quick differentiation with stony hard glands. My friends, my top 5 for stony hard glands, if you're taking a note, calcarea fluid, I shared with you. Cystis, I shared with you. Do remember conium. Do remember phytolacca. Do remember bryonia are your remedies for stony hard glands. I repeat, calcarea fluid, cystis, bryonia, phytolacca, and conium. And you can add another one to that list. If it's more on this region, if you look at me, if it's more around the jaw region, bromium. Bromium has an affinity especially for left-sided glands. So, like a left-sided mumps or a left-sided glandular enlargement, especially around the lower jaw. So submandibular glands, submaxillary glands, or the cervical lymph nodes. If those are enlarged, if there's a stony heart, do think of bromium. If it's especially a very attractive, beautiful looking person. So very attractive blondes, obviously you won't get that in the subcontinent, but attractive, fair looking persons with stony hard glands, especially around the lower jaw, especially left side, that's more bromium. Other than that, few other remedies I'd like to share with you for glandular enlargements. We're coming close to the end. I use spongia quite a lot, my friends, for glandular enlargements. Do remember, whenever you have a case of thyroid enlargement or gland enlargement with a lot of suffocation at night, they get like a sleep apnea, waking up at night. A. B, with a lot of dry cough. C, with a lot of heart symptoms. You can get a cardiac hypertrophy in spongia. And that is quite important for a spongia prescription. So glandular enlargement with a dry cough, with the panic attacks. And thirdly, if you have heart symptoms, spongia is really, really useful. Few other very interesting medicines which I'd like to finish up with. We have a very useful medicine called Badiaga. My friends, Badiaga is a medicine which is again comes close to spongia because spongia is prepared from roasted sponge, but Badiaga is prepared from freshwater sponge. And in case of Badiaga, you have the soreness of the muscles. So if you think of the soreness which you find with arnica or you find with ruta, and along with that soreness, you have a lot of gland enlargements, Badiaga is your go-to remedy. So think of a case of fibromyalgia, muscles, aches and pains with a lot of glandular enlargement. Again, when your well-selected remedies are failing, do think of Badiaga in potency. And do keep a note when your spongia comes in handy, Badiaga will come in handy as well. Because you understand, sponge contains a lot of iodine. And you understand iodine is for glands. So spongia, Badiaga are your 2 sister remedies from the sponge group. And lastly, to end up, I'd like to share with you a very interesting medicine, and that will be our last remedy for the day, is Corydallis, Corydallis, Corydallis. Whenever, my friends, you come across syphilitic symptoms with glandular enlargements, I repeat, syphilitic symptoms, so you have a lot of mouth ulcers, you have a lot of salivation, syphilitic symptoms, syphilitic emaciation with gland enlargement, do think of Corydallis, Corydallis, Corydallis. Two other mercury remedies also work well for syphilitic symptoms with mercury with glandular enlargement: Merc bin iod and Merc protoiod. Those are your two remedies for syphilitic symptoms with gland enlargement: Merc bin iod, Merc protoiod. Bin iod is left-sided, protoiod is right-sided. But if you're having failures with those remedies, you can always think of Corydallis for syphilitic glandular symptoms. And that will be our last remedy for the day. My friends, I hope you enjoyed this program. I'm sure I kept the discussion, I kept the PowerPoint short so that I could do the comparative Medica, and I hope that was helpful, because you understand in today's world, glands is an important factor. Speaking a little bit about our course, I'd like to share that our course, which is conducted by THA about miasm, is a very important course, as I shared with you earlier on, because miasm is always like the elephant in the room, which no one wants to address. But whenever you doing this program, I've tried to simplify miasm, which I've learned as an ancestral tip. My granddad used to say, if I can do it, you can do it. So miasmatic prescribing, if I'm being able to do it, I'm sure you'll be able to do it. And we have done different factors in this course. We have started off with the general miasmatic discussion: psoriasis, psychosis, syphilis, tubercular. Then we have gone to the emotionals of each miasm. Then we have done quick head to foot of each miasm so that we can use it in practice. Then we have covered the common clinical areas. We have talked about bronchitis, asthma. We have talked about cancer, osteoarthritis, gastroenteritis. So common clinical ailments and how you can do a miasmatic dissection. Obviously doing comparative Medica all the way along. And then we have added few interesting cases to understand the dissection of the case miasmatically. We've added a case of psoriasis. We have added a few thyroid cases to understand how you're implementing miasms in your practice, because only way of learning it is by seeing cured cases like you saw today. And at the end, we have done a complete miasmatic dissection of 50 polycrests. So we have done polycrest, and I have taken up symptoms from Boricae, and this is psoriasis, this is psychosis, this is syphilis. So that will always help you to dissect the leading polycrest miasmatically. And I've definitely shared with you a list of top antipsoric, antipsychotic, antisyphilitic, and antitubercular to finish up the sessions. So if you haven't done the course, I'll urge you maybe to do it in the near future. Thank you.
Thank you so much, sir. That was indeed very informative. We learned a lot today from you. I would like to request our dear learners to comment in the chat box with their questions now. Dr. Banerjee will take your questions one by one in a minute. So let's see what questions we already have, sir. Okay, so a learner wants to know, how can we differentiate between calcarea iode and
good
calcarea
question.
phos?
First, you have to understand what is the common between both the remedies. You understand both are emaciated, calc iode and calc phos. My understanding, if you understand the sphere of action, you'll be able to differentiate. Calc iode, as I shared with you, is more affinity for glands. Head to foot, you name a gland, calc iode has an affinity for that. Whereas in case of calcarea phos, you understand it's more for calcium and phosphate deficiency. So whenever you have a calcarea with affinity for teeth, calcarea with affinity for bones, calcarea with affinity for milestones, that's more calcarea phos. Whereas calc iode is more affinity for glands, and calc iode has got to be hot. Calcarea phos can be hot or chilly either.
Thank you, sir. A learner wants to know, how can we take the pregnancy history of mother in selecting?
Again, a good question. Pregnancy history, I'll give you a simple example: the fall of the mother during pregnancy. And baby had convulsions immediately after birth. And always think of arnica. Think of a mom who had a fright during pregnancy. There's a case by Clark in his dictionary which mentions a mom saw her brother being burnt alive during the riots, and the mom had a tremendous fright during pregnancy, and the baby was born with twitches and chorea. And Clark prescribed gelsemium based on the history of fear and fright resulting in neurological manifestations. So you have the etiology in the parent, you have the manifestation in the child.
Thank you, sir. A learner wants to know, what are your views regarding vaccination for children?
It's a very debatable topic, to be very honest with you. What I learn or what I have understood, that vaccination is sometimes a boon for the underprivileged. Sometimes diseases which are fatal, vaccination is important for those. If you have read Organon, you'll see it's mentioned Hahnemann has advocated vaccination for smallpox and cowpox because those were fatal diseases in those times. So if you think of vaccination for fatal diseases, like a disease like polio, or which permanently disables you, I'll say it's essential. But if you think of a vaccine for a flu, I won't say it's essential, because it doesn't kill you ultimately. So it depends obviously from person to person, from homeopath to homeopath. But my personal views, you need a vaccine for a fatal disease, but you don't need for one which is not fatal.
Yes, thank you, sir. A learner wants to know that can you please talk something about Calcarea silicata?
Good question again. Calcarea silicata, my understanding, is a very chilly remedy. You have head sweats, which is a feature of Calcarea, which is a feature of silica. You can sometimes have very offensive foot sweats in Calcarea silicata. And also in Calcarea silicata, do remember, is one, you have insecurities of Calcarea. You combine that with a lot of low self-confidence, which is there in Silesia. So there's a lot of lack of stamina with the insecurities of Calcarea, and that's where Calcarea silicata comes to your rescue.
Thank you, sir. Okay. A learner wants to know a case of hypothyroidism with feeling of something stuck in throat. Okay. And the thyroid scan is normal. What do you suggest?
You have to go for a constitutional totality, but spongia sometimes helps in those cases if you feel like something is stuck in the throat. I've had a few responses with Coccus cacti as well. Coccus cacti can have an obstructed sensation in the throat. Sometimes that can be just emotional. So, you have to rule out if it's a globus hystericus or not. So that may be Ignatia valeriana or asafoetida. So differentiate on the basis of that if there is an emotional factor in the background.
Thank you, sir. A learner wants to know, for a case of sebaceous cyst, are there any particular remedies, or we should give a constitutional?
As I said, if you're stuck with the remedies, you think of Lapis alba, as I shared with you, for soft cystic swelling. Iodum group of remedies in general helps if you have a totality of calc or sulfur or baryta. Also, I found good results if sometimes a sebaceous cyst, what happens is discharges a thick white matter. Calcarea sulf sometimes helps in those cases, because you understand Calcarea sulf is a thick lumpy discharge. So calc sulf sometimes helps those cases as well.
Thank you, sir. Okay. A learner wants to know, can you give an iodatum synthetic remedy with glandular issues, but when the patient is cold, like chilly?
Not really. I haven't done that, because you understand, if you read Metromedicas, you'll see it's mentioned iodum is the hottest remedy. So you have to think very many times before prescribing iodum to a chilly patient. Likewise, you have to think very many times before prescribing sulfur to a chilly patient. So thermal relation for remedies which have a very definitive thermal relation, you have to give an importance to that. You cannot ignore that. It's almost like a contraindication, like prescribing sorinum to a hot patient.
Thank you, sir. A learner wants to know if they can have a book written by you, if there is a book already available. They would like to.
I'm still working on it.
that.
I'm hoping to finish it by this year. So it's Metromedica books, which had been written by my dad, Synoptic Memorizer, and I'm trying. It had about 60 remedies. I'm trying to do the entire BHMS syllabus on that. So it's taking a little bit time, because you understand of the number of remedies.
Yes. Thank you, sir. Really looking forward for the book. So, learner wants to know, what can you prescribe for hyperpigmentation below one eye?
That's a very vague question, really. You have to have a
Hmm.
good constitutional totality. If you haven't a good totality, think of any psychotic remedy, because hyperpigmentation is psychotic.
Thank you, sir. So I guess we have taken up many questions. Are there any more questions from the learners? We can take that up real quick, or else we can wind up here. Okay, learner wants to know what book you suggested for the children cases.
Boldland,
I guess we,
Borland, Boldland Children Types. It's a very good book um, for understanding. It's a 20-25 page book, and it will really, really help.
thank you, sir. A learner wants to know how can they learn from you about these great concepts.
As I shared with you, we have the course and the THA course, and we are planning more in the future. So I'm working on it as well. So you'll come up with that. So
Thank you so much, sir. I think we just have like a very less time left. Let's wind up here if you will
thank you.
allow me.
Yes,
Thank
please.
you so
Thank you.
much, sir. Uh, I would also like to inform our learner that on your screens you can see THA have come up with an offer, and you can avail 30% off on Dr. Banerjee's course, Learning the Art of Rapid Classical Miasmatic Prescribing, on our website, www.thehomeopathicacademy.com. You can use the code FD30 to avail the 30% off. Another important thing, you can see a section of poll on your chat window. I would request you all to please send us your reviews on the webinar today, so that we can ask Dr. Banerjee to do many more webinars with us in the coming months as well. Okay. So thank you so much. Let's wind up here. So thank you for such an informative and enriching experience. I would like to extend a very warm gratitude on behalf of THA and on behalf of the DGen group. I apologize to those whose questions I couldn't take up because we were running out of time. Also, to inform our learners, we have an upcoming free webinar by Dr. Akshay Swami scheduled for 5th of September, 3 p.m. You will soon receive the link for registration in your mail and on our social media handles. And I'll provide you all on our WhatsApp update group as well. So thank you so much, sir. Would you like to say something to our learners?
Yeah, thank you for joining in, those who did. And if you haven't registered for the course, it's really informative and practical course. So make sure you do it. It will always help. Thank you.
Thank you, sir. I thank you all the learners, the homeopathic fraternity who joined us here today, and of course, Team THA for making this webinar, as well as THA a success. Thank you so much. Have a great evening, everyone. Keep learning, keep improving.